I believe strongly that if this critical access hospital in Hinesville, Georgia, can have this program and make it work and change the lives of our mothers in our community, that other hospitals can do it too. And if we can do it as a critical access hospital with very limited resources and still knock this out of the park and be changing lives of our moms in our community, they most certainly can. So this is definitely a program that can be replicated to help decrease the maternal morbidity rate.
About a week after I gave birth, my blood pressure was higher, much higher, but I couldn't lay down flat because I couldn't breathe. And I was swollen, like my feet and my nose were swollen. And I just didn't feel good. I didn't feel like holding my newborn son. So I went to the hospital and they admitted me right away and found out I had fluid on my chest and they were like, "I'm sorry, I know you're only a week out of your postpartum, but you got to stay overnight in the hospital."
And just like Tony, their pressures are sky high. They're going into congestive heart failure. They're having fluid buildup, and it's making them feel like death. They feel terrible. They feel run down, extremely tired. Don't even want to hold their baby, but everybody makes excuses. So it's good that we have this in time follow because we can say, "No, Mama, that's not okay. That's not okay. That's not normal. We need you to come in. Your blood pressures are crazy. This is a problem," and we're able to in real time help them.
So, full disclosure, I am Jamaican. I got married 3 days before medical school. I actually had always planned on becoming a pediatrician, and then in my last year, decided that I really wanted to pursue obstetrics and gynecology and wanted to become a pediatrician because I had a difficult childhood in terms of illnesses, and in particular, had a surgery that ended up being an emergency because the pediatrician thought I was avoiding school. And so I had this passion to like save all the children in the world by being a pediatrician. But when I actually did my rotations in medical school, really fell in love with women's health. And it just made sense that if you work on helping moms, then you really get a chance to impact everyone in the family and the community. But to keep it on a more realistic level, I had my son in medical school. And so I realized babies cannot tell you what's wrong. They just holler at you. And I thought, this is going to be interesting. And so my interest in taking care of babies, I think, changed because I had a child. As an OBGYN, though, you do have an opportunity to serve as a dual advocate for both mom and baby.
We're a critical access hospital, which means that we are small and we are in between bigger cities. Savannah is an hour away from us. We have 4 labor rooms, only 4 postpartum rooms, and 2 triage rooms on our L&D unit. And we have 25 beds, I believe, on med-surg. Our nearest tertiary center is Savannah, and that's where we send our very, very critical patients, trauma victims, and our babies that need a NICU. It's kind of like a family atmosphere here. We know everybody very well. We get to know the doctors very well, our CNO very well. Everybody in the hospital we get to know very closely because we are a critical access hospital.
I was one of the very first pilot patients before the program really launched. They just kind of wanted to see if it would work. So, one of the cardiac nurses approached me while I was in the hospital for postpartum heart failure and told me about the program and see if I would be interested. And we just went over my lifestyle and the things that I could do and what the program was really all about. So, and that's how I became a part of the Mom's Heart Matters program.
You know what's fascinating to watch? Even the change in outlook and mindset of clinicians who use a GOMO program like Mom's Hearts Matter. Heather was telling us that it started just with folks with certain diagnosis relating to hypertension, preeclampsia, other things. And now, because the program covers lifestyle wellness, mental health, it has a PHQ-2 and the Barkin Index and breastfeeding and all types of stuff. They now enroll every woman. It's just fascinating to see that mind shift within the staff and then the patients.
Well, I'm glad that you are asking me to share that because I really think that what we're doing is not terribly unique, but the way that we're doing it and the platform allows us to touch our patients in a way that we were not able to. And so a lot of times when moms deliver, I really think the original mentality is, out of hospital, out of mind. And it's changing not just for our staff, but it's changing for our patients, where even though they're not physically in the hospital, they know that we are, I don't want to say watching them, but we're connected. And so I think that gives them almost like a sense of security that they may not have had, where if they call, they may or may not get the office or the answering service, but they have this direct communication point because we're monitoring them.
Exactly. I was given a blood pressure cuff, so I don't have to keep writing my blood pressures down. So it gets actually sent to my doctor and to the perinatal department. So they're keeping track of my numbers, and I'm keeping better track of them because it goes straight to my phone.
Mom's Heart Matters is a program that we created to help the mothers in our community. It is a program where we can actually physically see our patients in real time at home once they are home. Any postpartum mom with any blood pressure complications or issues can automatically be enrolled in this program, and we can monitor them in real time at home. We can intervene in real time at their house. We can retitrate their meds at home. They don't have to be going to the doctor's office and dropping everything they're doing. These are busy mamas. They don't have a lot of time to spare. So we're able to do kind of like home care, get them at their house and be able to manage them properly remotely in real time wherever they are.
People use the term joy in practice, and there's been a lot of doctors, nurses leaving the field, not enough workers, everyone's stressed, reimbursements are down, and you can't be with the people at home, work, and play all the time. You want them to do things. And we just heard from Tony, and we've heard from you in the past that Mom's Hearts Matter really is your voice, your extension, that you're really cognitively with them in their environment. Just talk about how that helps you enjoy and practice and helps you feel like you're making a difference and your staff.
It's really cool. This program allows us to really get to know our patients. We become their support at home. We get to know them. The moms in the blood pressure track support system, have the ability to text 24/7, 7 days a week, our MHM support phone. And so we really get to know those moms and build that relationship of trust with them. It's just beautiful to watch, to know that we're making a difference in their lives. I mean, that's everything.
I'd say maybe I'm guesstimating a third of our patients that we enroll are not our patients in terms of their prenatal care. They may live in the surrounding areas or in the county, but they're delivering somewhere else. And then they're coming to us to the ER because they have symptoms and they're not sure. And then we admit them, we manage them. But they hang out with us and stick with us for our monitoring because they feel so connected. I think that it really elevates the level of care that we would love to provide, but don't always have the capacity to provide. But we can do it in a way where we have the alerts so that we know if things are out of control. I am super excited that not only can we identify things early, but we can intervene early. We've had a couple people that we've had to admit and, do things to, but for the most part, Heather and I communicate often. And so we can really make that change. You cannot make people care, but the staff here, there's a community of caring.
I did have a bunch of anxiety and stress going through that postpartum phase, and well, I was lucky enough that I had physicians and my husband there to take care of me, but also I would get random text messages from the Mom's Heart Matters program like, "How are you feeling today? On a scale to 10, how are you feeling?" And most of the time I was like stressful, or but then they would always reply back like, "Do you need to speak to someone?" But that's what I like. There was always on top of things before before I would even know.
Fireworks just like went off literally on a Sunday afternoon, sitting in the parking lot of Liberty Regional, having been here. It was probably my second weekend shift. And so we said, well, we really should do something with this. They already have this set up for the referrals. And so maybe we could work on, helping women. The same weekend that happened, I had a patient with elevated blood pressures who I tried to order a blood pressure cuff for her. And I documented that experience, which I've used on a slide. It took me 5 days and I think 100 minutes to get one. And they had to mail it to her house. But I had gone to Kroger and I bought her a blood pressure cuff and I bought her the medication container so she could remember what days and what time. And so, really, that was the stem. So, the challenges that I experienced here and then in communicating with Heather really were the building blocks of can we really elevate what they were already doing to a program that we could really offer to the community. And so that's kind of the short long version of just really how, my mentor was the one that invited me to be here, but it's like being in the right place, the right time with the right people, and then all the connections that happen and what we did. And then, of course, getting connected to Gomo Health. I mean, all of that happened in a very short time. It really was unusual for us to be able to discuss and implement and, launch something to that degree in such a short time. And so, really just happy to be able to see that come to fruition.
We all need a good friend or someone checking in on us and then sending us helpful information. And it's interesting. It doesn't really matter if something's helpful if it's coming from a human speaking to you over the phone or via the Mom's Hearts Matter program. If it's helpful to you and it's coming to you, it's probably indistinguishable.
Correct. And I would also get other reminders like, did you take your blood pressure medicines today? Are you drinking your water today? Like, did you follow up with your OBGYN? Did you follow up with your PCP and stuff like that? I really like that because I was already tired, and so just have those helpful reminders just coming in. So that's what I really enjoyed about it. For me, being a first time mom, I didn't know real much about the breastfeeding and what I should be doing. So, they always push me, you make sure you drink your fluids and you need to eat because if you don't eat, then the baby don't eat. So they always try to push me to stay healthy. And even if I didn't feel like drinking 100 ounces of water a day, I had to stay on top of it because I'm not living just for myself now. I have to live for my kid. And then I had Sandy, which was one of the cardiac nurses, text me almost every day, "Are you doing your exercises? How are you doing your exercises?" Because she do 30 minutes of cardio every day. And that's something I wasn't doing. I'm like, I'm not really getting to it. Well, if you can get at least 15 minutes a day, that's good. So it started with that, which was a real struggle for me in the beginning with not feeling well. But now I've developed into a lifestyle. While I am doing 30 minutes of cardio a day, normal routine, I'm drinking 100 to 120 ounces of water a day. My food choices have changed dramatically. I'm living just a much healthier lifestyle because of this program.
Yeah, the Mom's Hearts Matter program developed by Gomo Health, that's the whole idea behind the science. And you're a living example of it. It nurtures you with messaging and support, as you indicated, for you to develop a routine, which forms a schedule, which begins to change your outlook. Like, I can do it, I can help myself, which actually causes positive changes in your brain. In neuroscience, they call it neuroplasticity. Your brain loves to change, but it could change and ruminate and be negative, or it could change positive. So it sounded like that nurturing, both from the staff and the Gomo program, really helped you change your lifestyle.
It really did. And I feel like if I didn't make changes, who knows what would have happened.
So last year, when we launched officially in February 2023 with the GOMO platform, and we had that launch, initially we had a blood pressure support track, and we were focused on helping these moms out when they go home that have blood pressure issues and trying to stem off cardiovascular disease and congestive heart failure with these moms. We eventually grew and morphed into adding a strict postpartum support only track that would give them postpartum support on postpartum diet, exercise, nutrition, stress management. We would send them the Barkin Index via text message, and we'd send them the PHQ-9 depression scoring questions via text message. And so they get all this support, and they didn't have to have blood pressure issues. And in the beginning, when we first created that second track, It was initially for moms that had social deprivations, that had no support, that were struggling financially, that we knew already were in difficult straits. We made sure we signed them up for that postpartum support track. And then as the year went on, it morphed again, and we grew again, and we morphed again to every single mom that steps into this hospital, she gets to be enrolled when she goes home. Every postpartum mother gets to be enrolled. Who's to say in 6 weeks or 3 months that she's not going to have postpartum depression? So now it's every single mom, postpartum mom, that comes into the hospital, they can be enrolled in the MHM support track. And we follow them and message them for a full year. So they have support and information for a full year of their postpartum journey and that first year of parenting.
Wow, I think we'd all love in all aspects of our life some help for a full year, right?
Depending on what people have in terms of access to care, it differs in different communities. There's also the feeling that if you're in a rural community, maybe the quality of the care may not be the same, and so they may not want to stay at home and do that. But I think with time and with programs like Mom's Heart Matters, we can demonstrate that the circle of care and the network that we can provide really is not just about the pregnancy, but what happens afterwards. And one of the really cool things about Mom's Heart Matters is our program and our monitoring and our resources don't stop at the end of the 6-week period. It doesn't stop at the end of 3 months. We actually are following our moms for the entire year.